Just after the CDC announced their updated COVID-19 guidelines this week, North Mississippi Health Services announced that they will limit their emergency departments to patients with severe medical issues or those who need hospitalization. Stephen Pimpo met with their chief medical officer today to discuss what they expect from the Omicron wave. Stephen?
Winston, thank you. Dr. Jeremy Blanchard told me this is now the second time during the pandemic that they've chosen to limit those emergency departments due to a spike in patients. With staffing shortages continuing to plague NMHS, he says they are doing everything they can to provide the best care they possibly can.
It was predicted by everyone, but it sure was hoped it wouldn't be true.
It was back in August that leadership from North Mississippi Health Services warned residents that the state's slow vaccination progress could open the door for another COVID-19 variant that would render the shots less effective. Now, the current Omicron wave has made that a reality.
With Omicron, we're going to see the same level of infection probably in unvaccinated versus vaccinated versus previously infected.
NMHS Chief Medical Officer Dr. Jeremy Blanchard says a significant increase in, quote, very, very sick patients is stretching staff and resources even more.
People are working repeated shifts. People are working, under situations they never even entertained.
North Mississippi Health Services says that right now they're at about 75 employees and providers who have either tested positive for or been exposed to COVID-19.
That group, we are seeing about half are vaccinated, half are not vaccinated, and then the booster is a smaller number of that half that are vaccinated.
Dr. Blanchard says it's that varying degree of vaccination that complicates the immediate impact of the CDC's new shortened isolation periods.
If they're asymptomatic, will help us dramatically as well, because the asymptomatic can fall within that 5 days. But if someone is symptomatic or has ongoing symptoms or fever, it really will not change our approach.
Dr. Blanchard says staffing is at one of its lowest points of the pandemic. And while U.S. health officials have said the Omicron wave could peak in January, he says that is far from certain.
If it were to be shorter, if it were to be less acute, less serious, that would truly be a blessing. Will it be that? I can't tell you.
Dr. Blanchard says NMHS has both urgent and primary clinics for those needing routine medical care or COVID tests.